Hi, I'm Dr. Malarvizhi. I'm an ER physician, emergency physician. I head medical services and emergency department in AASRA Hospitals. I have 13 years experience in emergency medicine. At AASRA, we have a team of experienced emergency doctors, nurses and paramedics. Our emergency care starts before the hospital enters the hospital only. We call it as pre-hospital care. Once they enter a hospital, we will triage the patient as per their medical emergencies and treat them accordingly. Apart from the treating normal emergencies, we have also specialized in treating cardiac arrest patient. That is our main work stream, where cardiac arrest is where we will restart the stopped heart, or we will restart a heart which is beating abnormally. We in AASRA Hospital treat patients based on specific protocols so that quality patient care is delivered to all patients, and we also aim in improving our quality of care by doing regular debriefing and discussions as a daily basis. We also train doctors to take up airlift ambulances and on-road ambulances also. So right from the point of entry till the patient goes out of the ER, we look into each and every minute details of the patient. We believe in holistic approach towards the patient. At AASRA, we aim at delivering excellence in healthcare by delivering a proper, timely medical support. At AASRA, we are here for you 24/7.